Doctors say an overwhelming majority of Americans, especially people here in Southeast Louisiana, are already taking in way too much salt every day. And now there's, of course, the added concern about adding even more salt if the salinity levels in the water go up. So medical reporter Meg Ferris got some medical guidelines to pass along to you today.
LSU Health public health expert Dr. Ben Springate says there are some people who have to pay very close attention to how much sodium they're taking in. Those are people with high blood pressure, heart disease, congestive heart failure, and kidney disease.
If you're taking in more salt than usual and you have one of those conditions, that can be harmful for you, and we don't want to end up with people having exacerbations of their kidney disease, exacerbations of their heart failure, their blood pressure going up significantly, which can lead to hospitalization or worse.
To make matters worse, he says too many of us already get too much sodium in our daily diets. Canned foods and soups are loaded with added sodium. Some frozen dinners are too. These labels read up in the hundreds. Healthy people should not have more than 2,000 milligrams a day. Diets often have as much as 3,500 a day. Cutting back to 1,000 a day can help lower blood pressure.
Salt intake causes oftentimes fluid to increase in the body. You don't end up excreting as much fluid, and that has bad effects on your high blood pressure. It can cause your heart to have difficulty pumping if you have heart failure, and it certainly also impacts your kidneys as they're trying to get waste out of your body.
And he has this advice for people who don't have those health conditions.
Too much sodium in someone who's healthy can contribute to the development of high blood pressure, can contribute to worsening heart disease, and so these types of things make a difference over the long haul. In the near term, unless you're drinking or eating a lot of salt, it's not going to have a big impact, but over time it can make a big difference.
So the bottom line, as you count your sodium milligrams in your food, you now may need to add what's in your water. Meg Ferris, Eyewitness News.
People with those special health conditions can make sure they're not getting added sodium in their diets now by drinking bottled water. And you can get the latest on the salt wedge and take a look at frequently asked questions about it by texting the word water to 504-529-4444. We'll send a link right to your phone, and if you have any questions, you can also send them to that number.